Hey guys, Dr. Dave here. Have you ever had a sore neck, shoulder, arm, back, or hamstring while playing pool? I sure have. With me today are sports and occupational therapists Brad Ott and Kevin Rhodes to give us some advice and share some expertise related to common pool ailments.
My team at Rebound Sports and Physical Therapy has spent over 25 years diagnosing and treating overuse injuries of almost every sport you can think of.
And while Brad tends to focus on back, neck, and pelvis issues, I specialize in shoulder, elbow, wrist, and hand issues.
This is part of a 3-video series covering the top 10 physical ailments pool players experience. This part covers wrist and hand issues. Because we firmly press the bridge hand thumb into our other fingers or hand, especially with an open bridge, the muscles at the base of the thumb can get tight and fatigued.
The pain that you're going to be having on the inside of that thumb is mostly going to be because it's constantly contracted. And again, you have to hold that position real tight, so the tighter you're holding it for the length of your time that you're holding it, that's where a lot of that discomfort is going to come from.
Fortunately, there are good and easy stretches and massages you can use to help keep this ailment under control.
The easiest stretch to do is just in a palm-up position. I'm going to have you grab a hold of the fingers right at the base of those fingers, pull those guys back. As you pull your fingers back, you're going to push that elbow into a straightened position. You should not only feel the pull here, but really through that whole palm as well. You're wanting to hold that a good 20 seconds or so just to get a good elongation of those tissues. The second one, and the one that actually targets that tissue a little bit more, is you're going to go into a palm-up position. You're going to reach under with your hand and pull back on that thumb and kind of push that wrist and elbow into that nice straight position. And again, you should feel that pull really right along that area that's sore in the meat of that hand. A massage for it, just to increase some blood flow and kind of move things around. And really the pool ball is the most handy item that you can use for that. And you're just going to use that guy and just kind of knead and massage in there, just to kind of loosen those structures up, get some good blood flow in there. Absolutely, that's it.
I've actually done something similar where I go like this and really get a little extra force in there. Is that advisable?
Absolutely. Okay. Another way that you can do it.
Actually, it gets both hands.
Absolutely. The only problem with that sometimes is that causes a little more irritation in one as you're pressing. Yeah. If you actually put it on a table, you can roll that guy around there as well. That Excellent. Might be a great way to do that without irritating the other hand.
Excellent.
All right.
When many of us form an open bridge, we put a lot of stress on the middle joint of the index finger. And when you hit power shots like this draw stroke, the joint can be stressed even more. Here it is in super slow motion. Notice how forcefully the shaft gets pushed down into the finger after the hit. Here's an explanation for what causes the discomfort.
There's a ligament called a volar plate that sits at the front of each of those knuckles in your hand, and the job of that volar plate is to prevent that finger from hyperextending. So whenever you're putting your finger in that position, that hyperextension is causing the irritation of the edges of that volar plate, and that's what's causing a lot of that discomfort.
Here's a small technique change you can make to limit the discomfort. Just bring your middle finger over next to the index finger to provide more support and to share the load. And here's some advice for how to deal with any discomfort you might have.
If that's really irritated, you can ice it, which helps to reduce the local irritation in there, or take some anti-inflammatories, which will help give a systemic reduction in the irritation and inflammation. If that finger is really irritated and inflamed and you're needing to play through some games or through a tournament, you can put some tape on that finger to help support it. The tape that I want you to use is going to have to be some sort of a rigid, non-elastic tape. Here in this case we have some first aid tape on the smaller one, and then we have some coaches or some athletic tape on this one. Again, either of those are going to be fine. When you put it on, I want you to keep that finger slightly bent, right there, right, and then we're going to have a second piece, beautiful, that we're going to put on the middle inside portion of that finger, right? And then you're going to place another piece of tape on the top or right around it. Again, not too tight. This is not to cut off any circulation, just to help stabilize that tape so it doesn't slide right there. And then one last piece, Dave, that we're going to put on the bottom to do the same thing, to kind of help stabilize that guy so that that tape can't slide away from us. And that should give some support whenever you're pushing that finger down. That tape will absorb a little bit of that load for you.
Yes, it's not tending to hyperextend as much now.
Not to bow as much, yes. That's right. Yep.
A playing glove can also be used to help keep the tape in place. Even if the tape were high enough to be in contact with the shaft without the glove eliminates any extra friction the tape could cause otherwise. If you hit lots of power shots like the break shot, you can sometimes get discomfort in the front of your wrist. Here's an explanation why.
Dave, the reason that you get that pain on the inside of that wrist, on the thumb side of that wrist, is when you're drawing that cue back, right, and then you're engaging all of these muscles right in here, and you have three muscles that work that thumb pulling you forward, and then one muscle in your forearm on your wrist that's pulling you forward. Essentially, you're overtaxing those tissues. You're causing those little tendons to grind against that bone in there, and that irritation is what causes that thing to start bothering you.
Here's some advice for things you can do to treat the ailment.
Some basic things to do for that, just to decrease the irritation and the swelling in there, is rest, ice, anti-inflammatories. That's going to definitely calm that thing down. Again, if you're playing through a lot of this stuff, if you have a tournament or whatnot, stretching it, gentle stretching, never to the point of pain, is really what you're looking to do. The best way to stretch it is to take that thumb, touch each finger, stop on the tip of that pinky, slide down to the base, and gently fold those fingers over the top. And now I want you to pretend that you're pouring a glass of milk. You're just dropping forward right there, and you should feel that tug right over the top. So again, the key here is no pain. If it's inflamed, if it's really angry, that's not going to feel so great. So we want to back off, and I'm just going to have you rest the thumb on top and drop forward to create the stretch. If you don't feel it there, you're going to baby step across your hand under the index finger. If that's okay, you're going to go under the middle finger. If that's okay, you're going to go under the ring finger. Essentially, you're working that thumb across your hand, finding a place where you feel a stretch, but not pain. There we go.
Really stretches in this position.
Absolutely. Yes. The other thing that you can do here, Dave, is you can get a piece of kinesio tape or something to that effect, stretch it right over the top of that wrist, bend that wrist into a flex position, and put the tape over the top. That way, as that wrist comes up, you're creating a little bit of support, a little bit of a pocket in there. That'll help increase some blood flow to help that thing heal a little bit.
And where would the tape go? Onto the thumb some?
I want you to go essentially from about this knuckle to right about here, and you're stretching it, you're putting it on, and then you're allowing that tape to pull you back into a neutral position.
Be sure to watch the other 2 videos in the series for help with other common pool player ailments. We hope the advice and demonstrations help you experience less discomfort and allow you to play our great game for many years to come. If you're having trouble with any of the ailments, you can do the pertinent exercises and stretches as a warm-up routine before playing. You can also do some of them when playing while waiting for your turn at the table.
Okay, a couple things to remember. One size does not fit all with these stretches and exercises, but give them a try, see how your body responds, be consistent with them, and see if it can help prolong your career, improve your play, and make your body feel better.
Rebound Sports and Physical Therapy has over 25 years of experience helping athletes in many different sports. If you want individualized help with a pool ailment, or for more information, visit the Rebound link in the video description. And as always, good luck with your game from Dr. Dave.